Good morning, everybody. I'm Jill Furillo. I am the Executive Director of the New York State Nurses Association. Woo! And a big shout out to United Nurses of Alberta. First of all, I want to say that I'm honored to be invited here to address your convention today. And I am really inspired by the address of your President Gill. It was, I read the address, I wasn't here for it, but it is spot on in terms of everything that's happening right now in Canada, and certainly the exact same things happening in the United States. And I was also very inspired by Alan's remarks this morning. As a matter of fact, what I'd like to do is kind of pick up where Alan left off when he was speaking about the environment. He spoke about Mitt Romney's neglect of, or denial of what's happening with climate change and specifically with the oceans rising. And I want to tell you a story about that, about the oceans rising and the impact that that's had in New York. And as a result of that, what unions are doing to answer the issues around climate change, but more importantly, fight for democratic rights of workers in the city of New York. As you are aware of, we had a massive hurricane that slammed into New York City last October called Hurricane Sandy. But Hurricane Sandy wasn't the first one. We had a hurricane just 1 year before that, Hurricane Irene, that slammed into Long Island and some of the more peripheral areas of New York. It's not very often that, year after year, hurricanes begin to slam into New York City. So one would say maybe there is an issue here with climate change. Wouldn't you agree with that? And so the story that I'm going to tell you is about what happened with Hurricane Sandy, specifically with our nurses and, of course, with our health system, which, by the way, is not a health system at all, and discuss what the nurses have done there. When Hurricane Sandy slammed into New York City, what we found was that we have a system of care in the city of New York called the HHC system, and it is probably one of the only public sector healthcare systems anywhere left in the United States. It's in New York City, and it is a series of public hospitals that are public sector, not-for-profit, completely public, supported by the taxpayers. And it's a system that is there for all. It is a system of care that everyone, regardless of how much money they have or where they come from in the world, how old they are, what race they are, what religion they are, they get care in that system based upon the fact that they are a human being who needs care. Now, we're very proud of that system in New York City, but I just want to again emphasize it's probably the only system left anywhere in the country that actually is a public system that's accessible to all. The majority of people in the United States get their health care in a very different way. I'm going to talk a bit about that as well. When Hurricane Sandy slammed into New York, what we found is that many of those hospitals, Bellevue is part of that public system, Coney Island Hospital is part of that public system. There's the Veterans Affairs hospitals, which are also public as well, that are affected by that, were affected by that storm. And Kohler Goldwater. These were four various different hospitals that are all part of the public system that were affected by the storm, and there had to be a massive evacuation of all of the patients that were affected by that. So what we found is over 1,000 patients alone in between Coney Island Hospital and Bellevue Hospital were evacuated without incident. Every patient was evacuated safely, securely. No one died. Little 2-pound babies in the neonatal intensive care units were evacuated safely and securely. And this was as a result of having a system in place that is based not on profit, but on people's needs. I want to compare that with what happened when Hurricane Katrina hit New Orleans. You're all aware of Hurricane Katrina. And you're probably aware of some of the horrendous stories that we heard coming out of Katrina. In New Orleans in 2005, when Hurricane Katrina hit, most of the hospitals in New Orleans were private, for-profit hospitals owned by a system called Tenet Healthcare. Tenet Healthcare is a for-profit system, and it is based upon, well, making profit. It has nothing to do at all with care of people. And the system itself had its headquarters in Dallas, Texas, where they were buying up all these hospitals in New Orleans and turning them into for-profit hospitals. When Katrina hit, 3 days before the hurricane hit, most of the people who were part of the management of those hospitals were told by their corporate headquarters, get out. You know, get out of town, get out of there, don't hang around. And that is exactly what happened. Most of the people who were the management, the administrators of that system left. They left town. And when the hurricanes hit, the people who were left to care for people that were in the hospital, meaning the caregivers in that system, were left to fend for themselves because the administrators were long gone. They listened to their bosses in Dallas and got out. And as we know, what happened in New Orleans was very different. Many, many people died in those hospitals. And those caregivers were left in a situation where they could not evacuate the patients safely. And very, very horrible things happened. So I want to contrast what happened in New York City with the public system as compared to what happened with private, for-profit health care that existed in New Orleans. What we have seen in New York City after Hurricane Sandy hit was we've had an incredible voluntary effort on the part of nurses throughout New York City to respond and do a lot of volunteer work in communities that were hard hit, such as the Rockaways out in Long Island, Staten Island, and of course in New Jersey as well. And it was really incredible to see the nurses' voluntary effort. But one of the issues that we raised was, why is it that nurses should have to volunteer to care for people in the time of crisis? I mean, shouldn't we have a system of care that is already in place, a public health system that is there to care for people when these disasters hit? That is what we should have, but that is not what exists. That is not what exists. As a matter of fact, what we have in the United States is we don't have actually a healthcare system at all. What we have is a healthcare industry that is based upon corporations and them making profits. That is the bottom line of healthcare in the United States. And what does that mean? That means that we have 60 million people who don't have any access to care at all, meaning that they don't have health insurance. And I know that there's been an attempt to try to change that with the Affordable Care Act, you might know as Obamacare. But the reality is that more people might have access to health insurance, but that doesn't necessarily mean that they're going to get care. And that this health insurance that we're talking about is health insurance that they will buy on the open market. They'll have to buy on the open market because it is mandated. But it doesn't necessarily mean that that's going to translate into actual care, because if you're buying a health insurance policy where you have large deductibles and you have high copays, then what most people do is they actually don't use the health insurance that they have because they know that it's going to come out of their pocket. So we have this health industry. It's a corporate industry that is based upon profits, and as a result, we have millions of people that don't have health insurance, and we have even more people who don't have actual care, even though they have insurance. And I want to give you an example of that. We have a nurse who told us just a couple of weeks ago about a guy who came into the emergency room with, all the symptoms of heart attack, heart failure, diagnosis, this guy needs to have open heart surgery. They rush him to the emergency room, and they're getting ready to open him up, and this guy demands that they leave him alone. He was 64 years old, so what does that mean, 64 as opposed to maybe being 65 in the United States? Well, what that means is this 64-year-old individual who is about to have open heart surgery, doesn't have health insurance, and doesn't have that access to care. So what he said to the doctors as they're rushing him to the operating room, and what he's saying to the nurses is, please, please let me go. I want to wait until I turn 65 before I have this procedure done. Right? Is that a shame? It is a shame. It is a shame. And the doctors and the nurses were pleading with him, saying, no, no, you have to have this done now. And he was insistent. I have a right to refuse this care, and I want to refuse this care. And the reason why is because his brother is a person who has been in bankruptcy. And why was he in bankruptcy? Medical debt. In the United States, medical debt is the largest reason why people file for bankruptcy, because they are in medical debt. They cannot pay their bills. And so this individual refused the care that he needed on that day. And that is just one example of what we are seeing with a system that is not based upon the democratic right to have health care, which every other country has, but we don't have in the U.S. Back to Hurricane Sandy and back to New York. So what was the answer of the healthcare system after the hurricane slammed into New York City? Obviously, there were hospitals that were taken out, and there were a few hospitals that were left to care for the patients and care for people impacted by the storm. So what happens right after that? Well, we find that the hospitals all got together. These are the hospitals that are, obviously not there. It's not part of the public system. The ones who are left decide that what we really need to do now is we need to close more hospitals in New York City. And we need to close hospitals in Brooklyn. And so what they began to do is they made these announcements about a series of hospital closures in Brooklyn, which is the largest population in the city of New York. And they actually quite suddenly said that they're going to close a hospital in Brooklyn called Long Island College Hospital, and several other hospitals in that same area, which is a medically underserved community. These are communities where it has been designated by the federal government to be medically underserved. And so what they did is they announced the closure of these hospitals. And of course, well, what are you going to do about it? The conventional wisdom is you can't save them. Why? Because there's no financial viability for these hospitals. Because after all, hospital care is based upon what? Money, profits, not actually based upon care. And so they began to start the process to close down these hospitals. And I want to tell you that what we saw was an unprecedented response on the part of registered nurses, physicians, caregivers, and people in the community to rise up and to protest and to push back on the hospital industry's attempt to try to close those hospitals. And what we began to do is we began in the hospital to try to educate everyone in the hospital as to what was happening and why this was happening, that this is part of a larger agenda in the United States, an agenda that you have been speaking about today and yesterday in your convention, which is the drive by Wall Street to maximize their profits at the expense of our patients in our hospitals and the general public at large. And that where are we going to start actually pushing back on Wall Street and the Wall Street agenda? And we felt that the best place to do that is start right there in that hospital in Brooklyn and start in all the hospitals in Brooklyn to push back against the Wall Street agenda. And so what we did is we began to educate the workers, the healthcare workers in the hospital, and then we began to educate the larger community that's serviced by those hospitals. And we brought them together in a coalition. And what we told our nurses and what we explained to the community at large is that the role of the union, the role of our union, the New York State Nurses Association, is to be the public advocate, to be the advocate for the patients at all times. We're not just going to be advocating for ourselves and our own wages and our own working conditions, but we have to be a partner with the public. and to answer the calling, really, the calling of unions to go back to our roots, where unions were fighting for a social contract for people. And that is the history of the American labor movement. And that is what we believe in the New York State Nurses Association, that we need to transform ourselves to be public advocates at all time and patient advocates. And so we built this movement, and we started to gain a lot of steam and a lot of momentum. Everyone was saying, all of the people in the healthcare industry, Wall Street, the politicians were saying, you're not going to be able to save that hospital. It's losing $100 million every minute. They kept changing. First it was $100 million every year, then it was $100 million every month, and it was $100 million every week, and pretty soon it's $100 million every minute. So, they changed their story. But, what we needed to do was to basically push back on, the lies that they were telling the public, and to galvanize the support from the public, and to question, really, this conventional wisdom that hospitals should close because there's no money. And so what we did is we went out to the community. We had everyone making phone calls to the governor and making phone calls to their elected officials. We organized rallies in the streets of New York. We demonstrated. We marched. We went everywhere we could. And we brought the nurses, the heroes of Hurricane Sandy, really, the nurses who had evacuated those patients to safety, and they led this movement. And so we brought them to the city council chambers. We brought them up to Albany. We lobbied in Washington, D.C. around the issues around the hurricane, because, the politicians were trying to say how wonderful it was that everybody responded so heroically to Hurricane Sandy. And what we wanted to say is, well, in the meantime, you're closing more hospitals, so this doesn't make sense. Don't call us heroes. We need the hospitals to stay open. You be a hero. Keep those hospitals open. And so we fought and we built the movement, and pretty soon everybody started to jump on board. And I think one of the reasons is that nurses have a very high profile. People respect nurses. It's the number one respected profession every year in the Gallup poll. And so we were able to, to basically put that face forward to the public and say, we are fighting for you. And as a result of that, I am here to say that yesterday afternoon, when I was getting on a plane to come to Edmonton, we found that the governor finally did intervene in the situation in Brooklyn, and the operator of the hospital has withdrawn their proposal for closure of the hospital, and the hospital is alive and kicking. And if you Google Long Island College Hospital, you'll probably see some of the articles today. And it's very rare in our mainstream media in the U.S. that unions are actually given, any, credit for anything other than that they vilify us. We're actually given credit for building a movement. Building a movement with in partnership with the public that was able to actually force the governor and force the politicians to keep the hospital open. Now, just a little bit on what's been going on in the United States. Who would have ever thought that public school teachers would be the most wanted criminals in our country? I would have never thought that growing up in the United States. That public school teachers would be vilified to the extent that they have been vilified. And what's so amazing is that all of us know that the economic crisis that we saw really hit hard in 2008, the worst economic depression since the Great Depression. We all know who caused that economic crisis and continue to create that economic crisis. It's Wall Street greed. It's the corporate agenda, right, that is responsible for the economic crisis, this whole housing debacle, with the mortgage swaps and all that. Everybody knows that that's what happened, but it was amazing to me how quickly they could try to jump out of it and instead blame the economic crisis instead of on Wall Street greed and the maximizing profits. Instead, they blame this crisis on public workers. It was amazing that they would do that. but they really have very sophisticated PR machines. And so what we found shortly after the economic crisis hit was that Wall Street was blaming the economic crisis on public workers, and that this had been long in the making in terms of their PR machine. There's an organization called the American Legislative Exchange Council, and you can Google that too, ALEC, ALEC. And that is an organization that was founded by the Koch brothers. Have you ever heard of them? Yeah, the Koch brothers. The Koch brothers, and their agenda is based upon deregulation of industry anywhere and everywhere. And the ALEC was responsible for the elections in Wisconsin and the elections in Michigan and many of those states in the Midwest area that they just infused so much cash, and they used their PR machine to try to mislead the public as to what the reason was for the economic crisis. And as a result, they were able to get some of their candidates elected, as you know, some of these governors in some of these states. And using their PR machine, they were vilifying public workers because, after all, we do know, and you all know, that it is your pension and all of the money that the workers get from their public pensions that is the fault of the economic crisis. And that is the story that they have attempted to tell in the U.S. And it's really amazing when you look at what the actual average pension is for a public worker in the United States. We're talking about maybe between $20,000 and $22,000 a year. If you're aware of the cost of living in the U.S., I mean, $20,000 to $22,000 is barely making it, and so for whatever reason, they were successful in being able to vilify the public workers and public school teachers and nurses and firefighters as the reason why there's an economic crisis. And so they were able to build their movement to try to take away pensions, benefits, medical benefits. I mean, the little bit of medical benefits that people have, they're going after that too, because that's also the reason why there's an economic crisis in the U.S. is some people actually do have medical benefits or insurance, so can't have that. And so what we've seen is the corporate attack, vilifying public workers, and then electing candidates who are now trying to bring in the agenda that's put forward by the American Legislative Exchange Council. And we saw an incredible uprising against that in the United States, in the state of Wisconsin. On the day one of the introduction of the legislation that would outlaw unions altogether in the state of Wisconsin, we saw an incredible uprising where workers actually walked off the job, came into the Capitol, took over the Capitol, and went back to the roots of the labor movement to try to fight against this agenda in Wisconsin. And it was unprecedented. I was there on day two. My brother is a public information officer for the Streets Division of Madison, Wisconsin, and one of the workers affected, and he told me, "You got to get here. We're in the streets and we're taking over the Capitol." So of course I would do that. So I was there day two, and it was unprecedented. I mean, we had, teachers, students, people from all walks of life, from private sector, public sector, coming together, rising up to protest what was happening. And our brothers and sisters in the labor movement were inspired by that movement. But there was, unfortunately, as time went on, there was the attempt to try to take this movement and push it into the electoral arena and to more or less not help to build what was happening on the streets. And that's what I wanted to talk about today, is the issue of representative democracy versus participatory democracy. And so this drive to co-opt this movement that was building in Wisconsin and just to put it into electoral arena where we know that most of our politicians in the U.S. are bought and paid for by the corporations, it's difficult to be able to to build your movement just on electoral struggle alone. I mean, obviously, we need to elect people who are going to represent workers in our legislatures and, in Congress. But we're not going to be able to do that without fueling the fire of our movement in the streets. And I think that. And I think that the lesson of our movement in Brooklyn, and the lesson of I think what you're doing here and what your conference is all about, is to educate, to agitate, to mobilize, and to organize a movement of workers and our allies around the social issues, such as jobs, health care, secure retirement, public education, and of course, a clean and safe environment. And that we have to be in the streets. We have to be obviously having, taking what we're doing in the streets and moving that into the legislature. But don't ever give up what we're doing in the streets. That's the lesson of what we did in Brooklyn, and I think that's the lesson for the labor movement as we move forward. That we are going to keep the pressure on and not just leave it up to the politicians to do it for us, because if we do that, they will fail us every time. Thank you.